Shanthi, welcome. We are back talking about today anxiety. I'm happy to be talking about this because it's probably the most common complaint any of us will work with, whether as just yoga teachers in a general setting or as a yoga therapist. And you know this if you already teach yoga, of course. Part of the appeal of yoga practice is the lessening of anxiety for, I would say, majority of people who practice it. Anxiety, there's a lot to say about it. It often comes with other conditions. It's not always standalone, obviously. As we know, when we're worried about something like our health, right, we tend to be anxious. It can also be an indicator of other mental conditions like depression or PTSD. And it can also rise from physical causes like nutritional issues or excessive drug or alcohol consumption. So there's a lot of ways anxiety can come up and can be related to other things, but I'd like to look today at anxiety in more of a yoga therapy or yogic context. The fourth sutra, when it comes to Styles translation, is at all other times the self appears to assume the forms of thoughts, vacillations, and the true self is lost. So at all other times, when it's not going well, we're caught in our vacillations, and the balancing effect, right, of the true self is not happening. So that's a lot of times what we're dealing with. And we'll see as we look through the Koshas model, which I'd like to look at now, how that could come into play. So, it's a sort of basic level, right? We're all a little bit anxious all the time because of these vacillations of thoughts. But of course, it's not a problem unless someone identifies it as such. So in the Koshas model, we could see how like imbalances could cause anxiety, and this could come out of any kosha. So you have, like, for instance, the Annamaya kosha, the physical body, physical tension or pain or poor diet, right, can all give birth to or be related to anxiety. And then if you drop down a kosha to the pranamaya kosha, reverse breathing, right, breathing into the chest instead of the belly will cause anxiety. Lack of proper pranic flow, such as in the 5 pranas, where the prana is not coming in, circulating, right, and then going up and down properly, or a more general lack of pranic balance in the body, and for that you could think of like vata, pitta, kapha, or intense emotions not being allowed to move through. So that's more of a pranic thing, where the emotions don't move from beginning to a peak and then dissipate as emotions should. All of these things you could see as anxiety producing and stemming out of the pranic body, right? And then you could drop down another kosha to the manomaya kosha, the conscious mind, and you could have excessive anxiety or worry, right, due to a philosophical even or a point of view problem, as I like to look at it. So that would come from not really understanding and having really considered how the anxiety or the worrying is not helping you along a path to resolving your problem. So that could manifest as control issues, sort of the way you might use like adrenaline to get through your day. So you use worry, right, to sort of push yourself through, but it's actually not really working. Maybe it worked in certain situations a little bit, but now it's gone global on you, so you're always worrying. So you could see that in the manomaya kosha. And then we have the vijnamaya kosha, right, which is the wisdom body. And there what you would see is the inability to access, inner wisdom or information, and this causes anxiety in people. So the way I usually have seen that is, and experienced it myself, I should say, for full disclosure, is being constantly worried about doing the wrong thing because you're never really getting any sort of wisdom or input, right, as to what the right thing would be. So if you're never getting what the right thing is, you're always doing the wrong thing, and that causes anxiety in a lot of people. And then finally we have the Anandamaya kosha, and as always with this kosha, right, an imbalance in following all the other sort of aspects of the self as opposed to the heart. So often, you're detached from your ananda, your bliss, your heart-based self, and this causes disruptions in the system. And I would say in this case, what you would probably look for is actually sometimes, if the ananda maya kosha is imbalanced, you get pranic disruptions from that. So you might be working in the pranic body, which is smart, but then you might also have to use some practices for the ananda maya kosha also. So that's how I look at it through the kosha. So you can see that anxiety isn't one thing, and to sort of label like, oh, you have anxiety, do these 4 poses or something wouldn't make any sense, because you could have it at any level of your pranic system. Like many conditions, but this one especially. So how do we work with anxiety? And the first thing I would say about that is I'm going to ask you again to remember that anxiety being a problem is always self-identified. So even if someone seems anxious to you, it isn't an issue until they identify it as getting in the way of their regular daily routines or somehow getting in the way of their peace or happiness. So that's the only time when we have anxiety as a disorder that we would work with. So in my mind, I divide anxiety kind of into 2 categories. One would be anxiety stemming from external events that would cause most people anxiety, say like a sick child that you're taking care of, or taking care of a sick parent, or these life things that are difficult, right? And when you work with that, you look at it more like anxiety maintenance, right? Working to mitigate the effects, but you're not really thinking like, I'm going to help this person get over their anxiety, because it's actually a reasonable response to be anxious in these situations, just not too anxious. So you're helping them manage it. And then the second way to think about it is anxiety that's generalized and not stemming from a particular situation, but it's fairly constant across all situations. Even though we may latch on to one situation at a time, say, it's pretty constant. Like, we feel anxious in all situations regardless of the external circumstances. And as yoga therapists, we can certainly help with both of these cases, but we might take different strategies. So in the first example, we're looking for techniques that work fairly quickly. So one thing you might try is anxiety always ends up in vata imbalance. So we might start there, breathing and moving, vata balancing pranayamas will help. And one could also work with the mano maya kosha by chanting for the lower chakras. The lower are more affected by fear, and fear is often a component in here. Fear of not doing enough, fear of not doing the right thing, fear of things not going the way you want them to do. So anxiety always has that fear component. So that Om Aim Hrim Krim Namaha chant we do might be a good idea. And then there's and that would work for both cases, but for generalized anxiety, for specific anxiety, you might work there. For generalized anxiety, it's a bit more interesting in that we really need to work with the proper kosha or koshas to help resolve it. So some people might really need to balance the physical, so you think like proper sleep, a reasonable diet that has steadiness to it, so their blood sugars are even, and they have proper, decent nutrition, and asana to free the physical systems of the body so they can work properly. And asana in this case would it be usually fairly balanced in terms of the way the body moves, and also followed by some version of shavasana or yoga nidra. Other possibilities would include vata pitta kapha practices to resolve those issues in the pranic body, and I've seen that work really well with people. And then often, you'll do those kinds of practices and they'll work somewhat, but what they'll really do is balance the person enough on the higher koshas to then allow the person to access a deeper kosha where the problem is, and then work with that. So that's another thing. So, often you wouldn't just dive right in to, let's say, the bottom 3 koshas. You'd probably start in the physical and pranic body, see how that worked. If it didn't resolve the anxiety enough, then you'd look deeper. That's usually how it works. But what I'd like to do now is share a practice that was designed for a client of mine. And this was arrived at over time, and this is what she ended up with. It used the top-down approach of using asana, pranayama, and then finally chanting, boom, boom, boom. And she experienced a huge drop in her anxiety levels in a really kind of permanent way from this practice. So after some tweaking, this was what basically ended up being her practice, which she did pretty much daily. I think she would pick and choose a few practices when she couldn't, and she also did the chanting parts and the pranayama as standalones a little bit, but generally she did this as a practice. So let's take a look at that here. So you'll see in this practice, the first thing I had her do was to sit and chant some low ohms, focusing on the root of her body. And those low ohms are there, again, to affect the lower chakras. So we're not quite into the more specific bij sounds, but we're using them to kind of prep that and get her feeling grounded, and she really liked that. And then we did sun salutes to warm up and to sort of find the pitta and catch up with the pitta so that we could slow it down. So 6 sun salutes, right? Moving rather, not super hard. She wasn't an athlete or anything, but enough that she got warm, right? No breath instruction, just straight up physical asana like that. And then once we had her moving around, now she's warm, and then we sort of began to get into the breath and sort of begin to slow it down. So you see number 3 and 4 is warrior 1 and warrior 2, and they're both moving and breathing. So now that she's moved around, kind of opened herself up and sort of caught up with her pitta, and now she can focus enough, right? And she's doing her moving and breathing, and we're working on balancing her vata with that, and also at the same time kind of working down the pitta, if that makes sense. And then we get on the ground, number 5, and we do cobra in an Ardha Salabhasana half locust combo. So basically inhaling, lifting the chest in one leg, and then exhaling down, and then inhaling, lifting the other leg, and exhaling down. We do that for 3 times each leg. So another moving and breathing. It's like slowing down, but also getting our back bends in. Then I had her do a down dog as a counter to that. And also as a precursor, just to set herself up for pigeon. So she'd do her down dog as long as she'd like. And then did pigeon both sides. Again, no breathing instruction. Now we're slowing down and doing forward bends. We've kind of like come from sun salutes, right? And now we're bringing it down. So you'll see that this asana is fairly brief, as yoga practices go, but it had all the components, and that's what I was going for. So number 8, we have apanasana, moving and breathing. A couple reasons there. One is the moving and breathing aspect. The other is the kind of sedative nature of that, like kind of rocking motion. And the third is to balance apana, which sometimes if the apana is not moving down properly, you get feelings of anxiety for no particular reason. So that was put in there to balance her apana on a regular basis. And then number 9 here, we got lying twist. We have this twisting motion now, which we hadn't done breath. We had 6 breaths inside, again, to bring her more internal. So I had her focusing on breathing into the bottom of her ribs. 6 breaths each side. And then we have number 10, legs up the wall. Inversions are always great to slow down the system and to slow down the mind if they're done properly. So this seemed like the best option for her, since something like a shoulder stand wasn't in the cards in any quick kind of way. And I had her with the legs up at the wall, like really focusing on slowing down her breath. So that seemed to work well. Then, if you look here, we have that sort of was her shavasana, right? Because she's lying down. So that worked well for that. And then we have seated pranayama, and she had just 2 rounds of pitta balancing Kapalabhati. This particular person was a little more pitta, and I wanted to make sure we had that under control. So I had her doing them fairly slow and really being sensitive to the heat in her body and kind of really getting in there and paying attention. And then that's followed by an Ujjayi breath, first with just breathing in and out with the Ujjayi full breaths, and then eventually pausing after the exhale just a little bit extra, as we've learned before. And that combination was to really set, the doshas and the pranic body kind of at the same time. depending on how you want to think about it. So those worked well, and then we kind of ended with a sitting practice, and the sitting practice was first Om Aim Hrim Krim Namaha, lower chakra work out loud, and I had her doing it out loud 6 times and then to herself 6 times. And that eventually became 12 times, and I think she told me that she extended that because she wanted to later. So she did that, and then I just had her sit still for 3 minutes, which began with a timer. She was very anxious, and being still with no instruction was a little hard for her. So after the chanting, I just had her sit there and just time it and relax. No breath instruction, nothing. Just sitting there, getting used to that idea. And then a bow. And in the bow, I had her say, may I be peaceful today, just to kind of give her a reinforcement of what she was going for. So that's the system I had for this person for anxiety. And I think what's to be learned from this really is what an anxiety practice might look like, that it looks a lot like, in some ways, a generalized yoga practice, except you still want reasons for all the things you do, based on what I said previously in this lecture. So you're either thinking doshas or vata pitta kapha, balancing each section of them. You might notice that I went with the chanting instead of the point of view. We didn't talk a lot about philosophy. This seemed more direct at the time, but you could go other ways. I could have had her reading things. There's lots of options. But this is just one example. This is just a template for something you might do. So I hope that's useful. I look forward to all your comments, and I especially look forward to working with you, with your clients who have anxiety, because this will come up all the time. Thank you once again. Om Shanti, Om Peace. Have a lovely day.